Hi, I'm Hilary Fish. I'm the Director of Marketing and Community Relations here at Natividad. I'm joined today by Dr. Nicholas Chee. Dr. Chee is a cardiologist with Natividad, and he's going to be talking about what cardiology means, what a cardiologist does, and your heart health. Dr. Chee, why don't you tell us what does a cardiologist do?
Well, thank you for having me. So yes, a cardiologist is someone who specializes in care of the heart. And so I would say that includes prevention of heart disease or heart-related problems, and that also would include management. So that would be long-term management of cardiovascular disease and patients with um, different conditions that will ultimately impact the heart.
Okay, great. So when should you see a cardiologist, Dr. Chee?
Patients can talk to their primary care physicians if they have concerns regarding, let's say, a family history of heart disease, if they have a history of a heart murmur, if they have had any particular symptoms, chest pain, shortness of breath. Those can all be initiated, or the testing can be initiated by the primary care physician, but at some point, there may be a need to discuss the findings or to have a more in-depth discussion about the conditions that might be affecting them.
So if you have high blood pressure, high cholesterol, those sort of things, those would be maybe reasons to see a doctor?
Yeah, that's absolutely correct. And primary care physicians do a very good job of controlling those cardiovascular risk factors, but sometimes patients may have more difficulty controlling the blood pressure or the cholesterol, and so they may need a higher level of care, and someone who might have more experience with multiple medications used for those conditions, and a cardiologist would be very helpful in that respect.
So can you walk me through what an appointment with you would look like? Do I just call? How do I get in? And do you do telehealth?
So a patient can certainly self-refer themselves, so that if they have concerns about their blood pressure, their cholesterol, if they have a strong family history, they can call the office and they can set up an appointment. Or if they have a certain type of insurance that requires a referral, they would talk to their primary care physician about seeing a cardiologist. And so yes, we do telehealth visits as well, but for initial consultations, I believe that all patients should be seen face to face. And then for follow-up visits and for management of their condition, telehealth would be part of that scenario.
Oh, that could make it really easy to keep updated on your care and see a doctor.
Absolutely, and especially depending on the distance that patients have to travel. Telehealth is very, very convenient. We have patients who come from down south, King City, Greenfield, and so having telehealth available to them is incredibly convenient, and it allows for better patient care because patients are less likely to not show up for appointments if they know that it can be done through through a video visit and they can be at home.
So here's the $1,000,000 question. What can you do to improve heart health, Dr. Chee?
You know, I think that with the information we have on the internet these days, we're always looking for good resources. And one of those resources is the American Heart Association. And they have something called Life's Simple Seven. And those are what the American Heart Association considers the 7 very important cardiovascular risk factors that each individual needs to be paying attention to. So the first is weight reduction. And so we all want to have an ideal or at least close to normal body mass index. And so that's important to be paying attention to. The next would be exercise. And so I try to advocate that everyone exercise at least 3 or 4 days a week. And just something as simple as 10 to 15 minutes of walking 3 or 4 days a week is very helpful for reducing cardiovascular risk. Blood pressure is next, and that would be, of course, trying to keep your blood pressure at the very least below 140/90, but more ideally 120/80. And so that, of course, would be important to discuss with your primary care physician or a cardiologist. Blood sugar, so diabetes is a huge cardiovascular risk factor and is quite prevalent in our present communities. And so that's very important to be checked for elevated blood sugar and for diabetes. If you smoke, which fortunately there are less people smoking these days, but if you do smoke, smoking cessation would be vitally important to reduce your cardiovascular risk. And so there are many good resources out there, whether it's a local drugstore and getting one of these nicotine patches or nicotine gum, or there's a lot of good oral medications that can help with reducing your tobacco use. So next would be cholesterol, and that's very important. So individuals should know what their cholesterol numbers are and should have them checked routinely, specifically if the numbers are very high. And lastly, diet. So dietary considerations are always the hallmark of cardiovascular risk reduction. And so we're always talking about monitoring your intake of certain carbohydrates or fats or saturated fats, and that's vitally important.
Dr. Chee, thank you so much for talking about heart health with us today. We really appreciate it. If you need more information, please check out the link in our post.
Thank you very much for having me. I appreciate it.